Hi, I'm Emmy,
Hi, I'm Kaya.
and we're going to be presenting on monkeypox for our epidemiology presentation. So the project goals, we wanted to gather information on what monkeypox is, explain the nature of the disease in relation to health disparities, lay out the cost burden of the disease for both the individuals that are affected as well as their families and public health agencies. We wanted to gather some practical recommendations for public health practice and practitioners and clinicians, and then explain the implications of the disease on public health as a whole. And I included a little fact sheet over here as one of the public health campaigns for monkeypox. It explains the symptoms and how it can spread. It tells individuals what they should do if they think they have monkeypox, what to look for, and how it spreads. And this is pretty much the information that's been included on most of the public health campaign flyers that I've seen.
So what exactly is monkeypox? We know that it's considered a viral zoonosis, which essentially means that it can be transmitted from animals to humans. And then on the diagrams here, we have what it looks like under a microscope, as well as how it is structured virally. So some signs and symptoms to look out for if you believe that you have monkeypox. They're very similar to any other virus where you have flu-like symptoms, the chills, muscle aches. It's different in terms of the way that it manifests on your body. You start to develop a rash, which then turns into little spots that start to flare up and become irritated, very similar to chickenpox. And so that's why it's really important to get them evaluated as soon as possible, and just recognizing that they will last anywhere between 7 to 14 days on the skin.
So as I mentioned before, I wanted to show some of the examples of the public health campaigns that are drawing awareness to monkeypox symptoms. As we can see on the one on the right, this one is just focusing on the symptoms. It has made the information super simple so people can see, chills, backache, lesions, swollen lymph nodes, muscle aches, headaches, and exhaustion. The problem is a lot of these symptoms are similar to what you might feel if you have the flu or, just a viral infection besides the lesions. And not every single person who has monkeypox or has contracted monkeypox has gotten all or any of these in combination with each other. So it has made it a little bit difficult to diagnose without the lesions. And again, on the left, just a different one explaining, you can also have, it explains what the rash and the lesions look like. As Kaya said, it looks like pimples or blisters, and they can show up anywhere on the body. And this one I decided to include as well because it did highlight the transmission as well. And a lot of the other ones just focused on the symptoms. So having the information available for the public to know exactly how it spreads can allow people to protect themselves and their families, but also to kind of reduce the stigma that has been going around about the disease, that it can only be spread through men who have sex with men, which is obviously very untrue. It is spread through direct physical contact with the sores, the rash, scabs, any part of that rash. Respiratory secretions, a pregnant person can pass it to their fetus through the placenta, and even just touching objects like fabric, sheets, towels that someone who has monkeypox has touched or put their body and skin on can transmit the monkeypox. So having this information out there, I think in a summarized way so people can understand how it's actually transmitted, can help people to not contract it and to also not impose stigma on groups of people that don't deserve it.
So some of the health disparities in relation to monkeypox, we have seen just from the cases that have been reported and demographics were collected that Black and Latino men who have sex with men are disproportionately more affected by monkeypox. And there are also some racial disparities in the rates that people are being infected, with Black and African Americans being 5 times more likely to contract monkeypox as compared to white people. Also, we see from both of these charts from the CDC that as the monkeypox has started to spread from the beginning of the summer this year to into the fall, that again, African American and Black individuals are highly affected more than American Indians, people of Caucasian descent. And then we also see that there is a large gender disparity, with men being significantly more impacted by monkeypox than women, transgender men, and transgender women.
And so the nature of the condition, anyone, again, who comes in contact with either an infected person or even an animal is at risk, which is not something I think a lot of people know or is made public. The most recent outbreak, as I mentioned, has disproportionately affected gay and bisexual men, but it is not a sexually transmitted disease. It is just spread by skin to skin contact. So again, touching objects and fabrics, respiratory secretions, touching, hugging, kissing, any of that kind of stuff. But also I think including that you can get it from, if a person with monkeypox interacts with an animal, that animal could carry it to someone else as well, which is something I think people were afraid of in the beginning of COVID as well, but something that is unknown about transmission seems to make it a little scarier. So just making sure that everyone in the public has all the information makes it a little more manageable. And the significance of the research questions of the information we gathered. As we've mentioned, we wanted to figure out what is monkeypox, how does it spread, who is most affected, is there a vaccine available, is there enough public health information available so people can make informed health decisions, what are the public health implications of the disease. And obviously all of the answers to these questions are important so that public health professionals can analyze that data, draw conclusions from it, and then disseminate that information to the general public.
So a quick overview of the methodology of the studies that we found that were related to monkeypox. The studies had qualitative methods with observational studies. There were interventional studies done as well as randomized control trials, particularly when trying to identify a vaccine that would be appropriate to treat monkeypox.
And so the public health implications, as well as the cost burden. So as we know, COVID did put a huge burden on the healthcare system, the public healthcare system. And this is the 3rd year that we have been dealing with COVID-19. And even since the beginning, we have not had enough testing supplies, haven't had enough vaccines, haven't had enough PPE. And that sort of, the supplies never reached the demand. So having monkeypox emerge at this time could not have been at a worse time. Health departments are still running very scarce in terms of supplies. They've had shortages in monkeypox tests, the vaccines, as well as the antiviral treatments. As I said, similar to what was happening with COVID and what continues to happen with COVID. So an implication of there being a shortage of tests does also lead to there being an unknown number of cases, because if people can't get tested, they can't test positive. So as the number of tests increase, the number of people getting tested will increase, which will make the number of positive cases increase, which sometimes can look like it is spreading more, but it's just people getting tested more often and able to receive those resources from public health. And another problem is that the antiviral treatment for monkeypox is very difficult to obtain. It's not that there isn't enough of it in the national stockpile, but it does not have FDA approval. So every time a doctor wants their patient to use it, they have to fill out an emergency use FDA authorization for each of those patients, which can take hours of paperwork, which is obviously very unreasonable for doctors to do at this time.
So currently, monkeypox is widespread, specifically within the United States. The states that are most affected are Illinois and Georgia, and then a couple of the states in the northeastern region as well. It's hard to get some data from some Western states as they just haven't been collecting it, or it hasn't been reported yet. And then we see when relation to other countries that particularly in Central Africa is where they have the highest number of cases, as well as in Spain and Portugal.
So all of the available vaccines currently come from what I mentioned as the National Stockpile, which is a federal storehouse of critical medicine and equipment that's held and basically stockpiled. That's just in the name. So it can be given out to states during public health emergencies. This vaccine was developed for smallpox, so it's not a monkeypox vaccine. But although this virus is very closely associated to smallpox, so they believe that it will work. And I put some information about one of the vaccines over here, the Jynneos vaccine. It is approved for the prevention of monkeypox. It is developed for smallpox, and it's given subcutaneously, which is different than a lot of the typical vaccines. And it is a 2-dose vaccine. So that's very important, especially when it comes to public health implications, because we saw this a lot with COVID. It's difficult to get people to come back for a second dose if they don't feel like they're in an imminent threat. So that's something that they've been dealing with a lot as well. A lot of the appointments that have been available for monkeypox vaccines are second dose only, and people are trying to show up and get, at least one, and it's not being made available.
So some practical recommendations for the general public include ensuring that if you believe that you have monkeypox or that you're recognizing the symptoms, to call your healthcare provider immediately, just so you can get that initial test and start to quarantine or isolate at home if it's found that you are positive. Also ensuring that you are avoiding all kind of physical contact with people, sharing of bedding or clothing as well would not be recommended. And then masking up as well around others if you do have to leave the home. And then recommendations for healthcare personnel, obviously higher ups and prevention and control personnel should be notified immediately if a monkeypox case is found and is positive. Continued use of PPE. There was a mention of, there's short supply of PPE, so it's really important that hospitals and private healthcare facilities are well stocked on that. And then just ensuring that if a healthcare worker does have to have contact with a patient, it's for essentials only in terms of their well-being and their care.
And then those are our references. So that is it. And I will